Hello there, I'm Roly Owers, Chair of BEVA's Health and Medicines Committee. Firstly, an apology. When I spoke to you back with an update in late April, I said I'd update you in early June, and now we're late July. We've met a couple of times since our April meeting in early June and yesterday on the 28th of July, and very much the issues we have talked about the three key issues have been exactly the same. Firstly, the important area of antimicrobial resistance, AMR, and I want to say a special thank you to Bruce Bladen and James Crabtree for the great work they've done. Had good discussions with a couple of the major software companies for equine practice management, and so there's a real chance we'll be able to produce timely, up-to-date and accurate information around usage of antibiotics in the equine clinical field, which is great news and obviously a really important step. But we're also making sure we link in with those wider initiatives as well. Around the area of Helmetic resistance, we had a really good meeting with a number of different stakeholders organised by Dave Rendell. I want to applaud him for the work he's doing here. We're going to reach out to the other veterinary associations and also reach out to the thoroughbred breeders and others within the sector to talk about how we can bring around change in how we worm our horses and protect the anthelmintic drugs we have still available and that still work. And of course, we talked about the Animal Health Trust, and since April, obviously, the news that the Animal Health Trust is closing at the end of July, which is a huge, huge shame for so many different reasons. But yesterday we focused around the future and the importance of the equine disease surveillance, the laboratory analytics, and also the research element that goes behind that as well. So there is good progress being made on that. It's obviously hugely difficult times, but there's a group which David Mountford from BEVA is part of and looking to try and find initially a short-term solution to answer the immediate needs, but then take a bit longer to look at what the longer term solutions might be around what the important services the Animal Health Trust did provide. This is the last meeting of the Health and Medicines Committee, probably, unless we have a last minute one, before the BEVA AGM in September. So I just want to say a huge thank you to all committee members for their work this year. It's obviously been, like for so many, an extraordinary year, but people really have come up to the mark, and I think we've made some good progress. And I hope as a committee we've been able to support you, the BEVA members, in the roles and the important work that you're doing. I hope you're okay in these extraordinary times we're living through. Take care of yourself, and thanks very much.